Hello everyone, I am Bhuvaneshwari. Today topics are control loops in modern ventilator design. Introduction to ventilator. Definition. Mechanical ventilators are life support devices that move air into and out of the lungs when spontaneous breathing is inadequate. Clinical setting. Intensive care unit ICU for critically patients. Emergency care for trauma or respiratory failure. Operating rooms during anesthesia. Primary goals: maintain the oxygen, remove the carbon dioxide to prevent the respiratory acidosis, protect the lungs from injury while providing support. What are control loops? Control loop, a feedback system that continuously compare measured patient variables, pressure, flow, volume with desired target. Types: open loop, deliver the fixed setting without feedback, prone to error if patient condition changes. Closed loop, continuously monitor patient response and adjust output automatically. Modern ventilators almost exclusively closed loop, ensuring adaptability and safe. Importance of control loop: stability, keeps tidal volume and airway pressure within safe ranges. Adaptability, adjusts to dynamic changes in lung compliance, stiffness and resistant airway narrowing. Safety, reduce the risk of parodrama damage from excessive pressure, volume damage from excessive volume, hypoventilation, indicating CO2 removal. Basic components of control loop: sensor, measure airway pressure, inspiratory expiratory flow, tidal volume, FiO2 and sometimes EtCO2. Controller, processor sensor data, compares with set targets and calculate corrective action, often using PID algorithm. Actuator, valves, bowlers and oxygen mixer that physically adjust gas delivery. Feedback, continuous monitoring ensure a rapid correction of deviation. Pressure control loop function, maintain airway pressure at a set level during inspiration. Mechanism, adjust inspiratory flow dynamically to achieve target pressure. Clinical benefit, prevent the over destination of alveoli, reducing risk of ventilator induced lung injury. Application, common in ARDS patient where lung production is critical. Volume control loops function, deliver a fixed tidal volume regardless of patient effort of lung mechanism. Controller adjusts inspiratory pressure until the set volume is reached. Clinical benefit, ensure the consistent ventilation even when compliance changes. Application, useful in surgical anesthesia and patient with predictable lung mechanism. Flow control loops function, regulate the inspiratory and expiratory flow rates to match the desired waveform. Mechanism, smooth flow transistor, reduce patient discomfort and work of breathing. Clinical benefit, prevent the patient ventilation double triggering flow starvation. Application, essential is in associated modes where patient effort interact with ventilator flow. Oxygen controller loops function, maintain the desired FiO2 by blending oxygen and air. Mechanism, oxygen sensor measure the concentration, controller adjust mixing valve. Clinical benefit, prevent hypoxemia while avoiding oxygen toxicity. Application, critical in patient with severe respiratory failure or during anesthesia. CO2 controller loops function, monitor end tidal CO2 or transaction CO2. Mechanism, adjust the respiratory rate or tidal volume to maintain the normal CO2 levels. Clinical benefits helps regulate the acid base balance and prevent the hypocapnia. Application used to advanced ventilator for fine tuning ventilation in critical care. Adaptive closed loop system concept intelligent system that automatically adjusts ventilation based on patient condition. Example adaptive support ventilation called the abdominal rate and tidal volume based on lung mechanism. Proportional assist ventilation provide the support proportional to patient effort. Clinical benefit reduce the clinician workload and improve the patient comfort. Safety features in control loops. Alarm system trigger alerts for abnormal valves, high pressure, low volume, disconnection. Redundant sensor ensure reliability and detector sensor failure. Fail-safe mode switch to backup ventilation or save difficult if control loop fails. Clinical benefit protect the patient from sudden equipment malfunction. Challenges in control loop design. Patient variability. Different disease COPD with ARDS require different control strategy. Sensor accuracy. Tripped calibration error and noise can establish loop. Automation with clinician control. Balance between machine anatomy and physician oversight. Clinical challenges designing systems that adapt without overriding clinician judgment. Future trends AI driven predictive loops, machine learning models anticipate patient need before deviation occur. Integration with EHRs. Ventilators may adjust based on lab values, imaging, or hemodynamic data. Personalized ventilation algorithm tuned to individual patient lung models or model from optimal production. Remote monitoring, cloud connected ventilator enabling tel-ICU support. Conclusion summary. Control loops are the backbone of the modern ventilator design. Impact they ensure the precision, adaptability, and patient-centered care. Future intelligent adaptive feedback system will dominate, making the ventilator safe and more personalized. Thank you.